started back in 1989. National Stroke Awareness Month began in May. It was created to promote public awareness and help reduce the risk of people having one. This year's campaign, promoted by the American Stroke Association, is focusing on awareness on the particular risks that women face with stroke. Joining us this morning to talk more about Stroke Awareness Month and what you can do to lower your risk is Director of Therapy Operations at the Encompass Health Rehabilitation Hospital, Lisa Brower. Good morning.
Good morning. Thanks for having me.
Absolutely. Thank you so much for joining us. I love this topic because too often we ignore the signs of these ailments that we could really take a handle on. So let's start there. Tell me about the risk factors for men and women, what they face when it comes to stroke.
Yeah. For women, pregnancy, high blood pressure during pregnancy, taking birth control pills and hormone replacement therapy are big ones for women. But migraine headaches with aura and smoking and atrial fibrillation also fit in for women and men.
Interesting. I never would have thought that pregnancy would be one of those or any type of birth control and hormonal changes. I think we too often just think of just hypertension and stroke.
Absolutely.
But there's so many other factors that are involved in this. What can we do as women to reduce our risks of potentially getting a stroke?
Yeah, you want to talk with your healthcare professional about prevention and management of high blood pressure during pregnancy. If you're taking or considering taking birth control pills, you want to make sure you're monitoring your blood pressure, no matter your age. You want to also talk with your healthcare professional and weigh the risks and benefits about hormone replacement therapy for you as the individual. You want to avoid smoking, nicotine, vaping, and e-cigarettes. And then if you're over the age of 75, you want to make sure you get screened for the heart condition known as atrial fibrillation.
Okay. Okay, so those are huge factors, many of which you should be talking to your doctor, your physician about.
Absolutely.
And these are conversations that you could have just at your annual checkup, or if you feel that maybe there's something wrong, maybe you should make an extra appointment.
Absolutely, and you can check your blood pressure at home. You know, 120 over 80 is the norm for blood pressure, and that's what we're looking for.
Okay, let's talk about that blood pressure because hypertension, as I mentioned, too often we think about just hypertension and stroke related. So how does that play a huge factor when it comes to strokes?
So hypertension can significantly increase your risk of having a stroke, and according to the American Heart Association, about 80% of strokes may be prevented with good blood pressure management.
Okay, all right. And as you mentioned, this is something that you could do at home.
Absolutely.
Should you be doing it on a daily basis, or is this something, if you're in a lower category with your age, is this something weekly? You
know, for younger populations, they say weekly, but if you have any history or any family history of high blood pressure, you want to check it more often. And again, that would be a discussion with your healthcare professional in regards to your age and your risk factors.
Okay. Tell me, there's one thing that you can do, we can all do to help prevent stroke.
Check that blood pressure. Talk to, on your well visits, talk to the doctor about that blood pressure.
Okay. Before you go though, because I think it's very important for us to talk about these symptoms and the signs of a stroke, because too often we ignore them, thinking it may be something else. So what are the signs that we should be looking for? So
they call it be fast. You want to look for any balance deficits, any vision deficits, any facial drooping or weakness. Those are really the biggest ones that you want to look for.
If you see any of those?
Yep. And the American Heart Association will tell you that a lot of people like to drive themselves to the emergency room. Time is brain, is like we like to call it with stroke. Call 911. Don't drive yourself.
Okay. Okay. You always think I have more time than what we do.
Yes, and time is brain.
Give us your website real fast before I let you go.
Stroke.org for the American Heart Association.
Perfect. Go there for more details.